Journalists Roundtable is a half-hour discussion with Pennsylvania journalists about the week's top political news and current events. Journalists Roundtable is a production of PCN, a nonprofit television network. Listeners like you make our programming possible. To learn more about PCN's mission and to support PCN with a donation, visit PCNTV.com. This link and others can be found in our show notes. We appreciate your support.
Welcome to Journalist Roundtable. I'm Phil Beckman. Today we are joined by Elizabeth DeOrnellas, a reporter with The Morning Call, Joyce Davis, opinion editor for PennLive, and Kara Jeffers, Harrisburg correspondent for Lilly Broadcasting. Thank you all for being here today. Kara, take us through your week. What kind of stories caught your eye this week?
This week we had the Pennsylvania House of Representatives was in session. There was some voting on the Fairness Act in Pennsylvania. Deals with just equality for members of the LGBTQ plus community, along with other protected classes. As far as committees go, lots of conversation about artificial intelligence continuing on. And then we also had a vote on a potential phone ban in schools that Pennsylvania lawmakers are considering making a statewide policy.
Joyce, what stories were catching your eye this week?
Well, of course, the one that's at the top of my list is what's going on with the Supreme Court and the Voting Rights Act, because that's going to have repercussions throughout, I think, the nation with eliminating any consideration of race in elections. So that's something that we'll be watching. Of course, this inflation, Iran and the war and how it is sending gas prices surging. I think people are starting to get a little bit, let's say, concerned. And of course, I wrote the editorial this week about political violence and how we have to make sure that as voters, we do not elect people that encourage it.
Elizabeth, what were you taking a look at this week?
Lots of enterprise reporting this week. Lehigh Valley Sustainability Summit at DeSales. Lots of talk about data centers there. That's on everybody's mind. Also, there is a farm meeting happening on Friday that I'm keeping an eye on when we're talking about impacts of the Iran war. Some of that is really hitting our farmers, that and tariff policies. So keeping an eye out for that as well. And then it is budget season and I cover schools. So tracking that, in particular, long-term capital and infrastructure needs for the Allentown School District.
Joyce, you mentioned the issue of political violence. Talk about your editorial and what your point of view on that was.
Well, basically the editorial, we've said it before, as I said, but we have to say it again. Violence has no place in politics. Politics is supposed to be about debating ideas for the good of the community or for the good of the nation or the state, not about bullets flying or killing people. And so we make that statement, but we also make it clear that this is a responsibility of each and every citizen, each and every voter. We get what we ask for in politicians. We get what we tolerate. And so to calling on our readers to make it clear, they do not tolerate this continued violent rhetoric and violence in politics, nor will they vote for people that don't denounce it.
Now, Kara, I want to start looking at some of your stories, and you've written extensively about pharmacies and some of the issues surrounding pharmacies, particularly the closing of pharmacies. Well, why are we seeing so many pharmacies close?
Yeah, we've had over 1,000 pharmacies close since 2020. So in the past 6 years, which is a lot. We have the Pharmacists Association of Pennsylvania really mapping this out, showing that there are pharmacy deserts that are popping up. Plenty of places, both rural and urban and suburban, where people have to drive over 30 minutes to get to a pharmacy. This matters for Pennsylvanians because pharmacists can be just accessible healthcare. They're not doctors, but they can be that person, just like a touch point for someone. Like, hey, maybe I haven't been to the doctors in a while. You're a pharmacist. Can you give me some input on what's happening with my health here? Can you point me in some directions? And so when we're losing our pharmacies, whether they be our local, like mom and pop shop community pharmacies, whether it be, chains like Rite Aid, it's just one less access point for people to get to healthcare. And the reasons they are closing is something that most people probably haven't heard about. Sometimes even pharmacists are like, how do these operate? Pharmacy benefit managers. They're kind of the middlemen of the pharmaceutical supply chain that exists here in the United States. You have the pharmacy kind of manufacturers, the creators of the drugs. You have wholesale manufacturers who actually, make the product once it's created. You have insurance companies, and then you have the pharmacies who actually distribute. And pharmacy benefit managers sit in the middle of all of these, participants and kind of negotiate like, oh, wait, well, for the pharmacy company and the insurance company, how much are you going to exchange each other for, any deals you make? And then for the insurance company and a pharmacy, a local pharmacy that you go to, they negotiate how much will the insurance company reimburse a pharmacy for filling a prescription. And that's most people who go into a pharmacy. If you get a prescription filled, you have insurance. And so it's a large portion of a local pharmacy's business is filling these prescriptions that are covered by insurance. Pharmacy benefit managers have been making negotiations where pharmacies get paid less than the actual cost of that prescription drug for the prescription itself, and some of the overhead of like we have to pay someone for filling the prescription, and you have the rent and electricity bills. So this is a problem that has kind of been growing. It's been on the radar for advocates in the pharmacy community for a while, but now we're really seeing that impact of these closed pharmacies. There is policy that's trying to happen at the state level and the federal level to address this, but yeah, it's a big thing that's happening.
You also spoke to students at pharmacy programs. How are the closing of pharmacies affecting their job prospects?
Yeah, I talked to some students from LECOM. I do coverage up in the Erie area, and they were talking about even if they don't want to go into community pharmacy, they are seeing that impact their workforce. Because as community pharmacies close, the pharmacists who are working there trying to find other jobs in other places, whether it's hospitals, whether it's more research or commercial. And so even if you're not wanting to go into community pharmacy, you are feeling that impact in the workforce. And then I talked to a student who she's from a rural area. She's like, I'm excited to go back to my community or a similar community and give back and fill that role. And those opportunities are disappearing for her.
Now, Elizabeth, you wrote about the Lehigh Valley Emergency Response Network. They have an ICE hotline. What would that hotline do?
It does a couple things. It monitors ICE activity. So if there are reports of ICE activity, that is something the hotline can be used for. It is increasingly being used for mutual aid also. So people are calling in saying, I am having trouble meeting my rent bill. I am having trouble finding groceries because I am afraid to leave my house, or the breadwinner in my family has been detained and I can't pay my utility bill, right? So it is increasingly not just sightings of ICE agents or potential ICE agents, because we have to recognize it is very confusing to kind of know what you're seeing with the way that multiple agencies have been involved in raids. The only large-scale raid in our area was in South Bethlehem, and it involved multiple agencies, not just ICE. So there's kind of a lot of confusion now when people see officers in the streets, whether those are ICE or whether that might be, DEA. We saw IRS involved in that raid. Like agencies that you wouldn't normally think of as immigration agencies are being used in some of these large-scale workplace raids. So there's a need, I think, for people. They feel a need to report activity and just kind of, report to someone who can help them figure out what that activity is. Because sometimes it's local police, right? Sometimes it's not federal agents. But again, figuring out like who federal agents are, who they work for, why they're there is very complicated. And mutual aid is an increasing need for our community. This is a heavily Hispanic community here in the urban centers of the Lehigh Valley. And not just in the urban centers. And the people who do that mutual aid are reporting both increased fear and increased need among our community members.
Now, Joyce, you had written about another immigration-related story. The Pennsylvania Immigration Coalition expressed concerns about the conditions at the Moshannon Detention Center. What's going on there? What were their concerns?
Oh, well, their concerns, yeah, and just like Liz, this is a huge issue, I think, in our area. The concerns that people have over deportations and the fear that people have, even to leave their homes. Even if they're legal, they're still afraid to go out and to risk even being wrongfully detained, because that's happening as well. But at Moshan, it's horrible because they're indicating that the conditions there are not only unsanitary; they think they're just downright, I mean, horrible, with worms being seen in water, and with the food, the milk curdled, and all of that. I mean, and there were reports they have of 3 deaths in recent years there. So they are really, many people are calling for that center to be closed. But the whole issue of deportations and the impact it's having on immigrant communities, the fear that's there is really is real, and it's impacting everyone, businesses as well.
Who manages the detention center?
That's a good question. I don't really know who manages it, but I'm assuming it's federal agents that are in charge of that. It's not state. I don't believe.
Have you heard about any potential policy resolutions to the issue there?
I have not, but I do know that there is a push, at least, to have the state take much more of an aggressive stance on trying to get it closed, or at the very least to try to get the conditions improved.
Now, Kara,
I mean, I
go ahead.
think that you are seeing a lot of debates about federal oversight versus private oversight of detention centers. I mean, one of the things we track with our partners at the Reading Eagle and also the Republican Herald is what's going on with these proposed conversions of warehouses into detention centers. And, we've seen in neighboring states, there are differences between the federal government owning a facility and a private company operating it, as far as if you're a local or state politician and you want to push back, your options are different. So in Pennsylvania, we're actually seeing environmental regulations being used by state officials to push back because the federal government has already bought properties. And so the Shapiro administration has decided we are going to use the Department of Environmental Protection. We are going to use these permitting regulations to try to make sure that our communities are not overwhelmed. These are communities that are already in drought, that are already facing water shortages, that are worried about things like, will our fire protection systems be overwhelmed? Like, will our rivers be further polluted, right? So like you're seeing this strategy in Pennsylvania of environmental regulations, but in other places, if a private company still owns a facility, there are other ways you can push back. Like we've seen in Maryland, they have tried to kind of examine those contracts and like look at their relationship with these private companies. So like it really, really matters if the federal government owns the building or
Yeah, and
not.
I've just checked. It's the Geo Group. It is a private prison corporation that is owning it. It's the Geo Group. So there may be some ways that the state, and I'm sure there's a push going on now for the state to kind of move in and do something about it.
Yeah, and again, you have different options, right? If you're dealing with a private operator, whereas if you're dealing directly with the federal government, we're seeing these large debates about state regulations versus federal government power versus local regulations, that is not just here, that is not just the Northeast, that is nationwide, that we're seeing these debates about how much local control do people have, how much state control do governors have, and this is bipartisan opposition. I really want to emphasize that this is very bipartisan opposition in our area. There's a lot of Republicans in these areas that are concerned about things like water shortages, strains on local emergency services, increased pollution. Like this is bipartisan opposition, and I think that people don't always realize how bipartisan the opposition is. People come to this for very different reasons from very different places, but that local pushback, it is local, it is grassroots, it is not just the Shapiro administration by any means.
Kara, as you walk the halls at the General Assembly, are these topics that you're hearing people talk about?
Yeah, just this week we had a press conference on welcoming schools, and there's definitely some Democratic lawmakers who are pushing for just statewide policy, statewide guidelines for public school districts on what do you do if you get a request from ICE? What do you do if there's a student who's scared? Trainings for teachers and students on how to respond in different situations. So it's definitely a conversation that's coming up. There's also, from some Republican lawmakers, continued conversation about identities and driver's licenses and state IDs, and are there things that we should put on those IDs to signify as someone, a citizen or non-citizen. So definitely a continued conversation in the General Assembly in Harrisburg.
Kara, I also want to ask you about a recent story. Senator Don Kiefer introduced a patient right to understand bill. What is the issue that's trying to solve?
Yeah, patients have a right to know what they're kind of going through with healthcare, but oftentimes we don't actually know. You can walk out of a doctor's office still very much confused on what your options were. You might get handed a piece of paper with a lot of small print, and most people are like, I'm not going to read that. So Senator Don Kiefer is proposing a patient right to understand. And really this gets to understanding your options, but also understanding the cost. And there's a lot of interplay between if I chose to pay for this just for myself versus if I have insurance, and some significant differences in cost for healthcare services depending on which of those two camps you fall in. The bill proposes that if a patient requests it, a hospital, a healthcare entity would have to give a 1 to 2 page summary of, hey, this is the care that you're thinking about getting. Here are the different options that you could take to address that care. And then here's the cost of all of those options. With insurance, without insurance, it's trying to get to this clarity on why is our healthcare system so expensive? Something that people are definitely thinking about when it comes to affordability is healthcare costs continue to rise. So this is one way that she's trying to address this issue. Definitely, again, lots of lawmakers coming at this from multiple angles for affordability in healthcare.
Now, you quote Dr. Danae Powers, who says there's no individual bad actors, but the entire system is crashing. What does she mean by that?
Yeah, it was interesting. This bill kind of got launched with also a new coalition called We the Patient, and I was attended the press conference. Lots of conversation for people not trying to blame insurance or trying to blame doctors or trying to blame hospital systems, but really saying this system has become so complicated that there's many players in healthcare that don't fully understand how it operates. That's what the members of this coalition are saying. So not pointing fingers at one part of the system, but saying we need to look at how this entire thing has grown so complex and ways to simplify.
Elizabeth, you write about the Parkland School Board. There's a proposed tax break for Eli Lilly, building a new facility in the area there. Can you talk about the significance of that, and how important would the tax break be for the school district if it lost that money?
I mean, that's the debate, right? That's the crux of the debate that is happening right now. These are tax incentives that are designed to encourage people to act in collaboration. So it's designed to encourage the township, the county, and the school district to kind of work in concert, but you do not have to. You can opt out, and we are seeing the school districts say we might want to opt out of this. We feel what board members have expressed is this balancing act between people want Lilly to come, right? They're very excited about the opportunities for growth. They're excited about job opportunities for their students. They're excited about workforce training pathways and this partnership with the community college, but they're saying we haven't seen concrete commitments. We have seen state money go to the community college. No one has said to Parkland, here's how your students are going to feed into that training pathway, or maybe we'll do internships, or maybe it's all a maybe now. So you see school districts saying, you are asking us to give up significant revenue, and everyone's budget is tight. Parkland has a reputation for being a rich district. That does not mean that their budget isn't tight. They are growing. They know they're going to keep growing. And so they're, projecting down the road going, this is a 10-year commitment. And can we really tell our constituents that we're going to give up tax revenue, even if it's partial, right? That we're going to do that for 10 years when our budget is tight. And what board members kept saying, and members of the public also is Eli Lilly is a massive, massive company. And, there are just some questions about why give a tax break to a massive, massive company on the backs of the school district. And a lot of pushback from the economic development people who would like to see everyone work in concert, and would like to see these incentives be put in place. So yeah, we're going to see this debate continue for sure. It's on the agenda moving forward in May. And this Lilly investment is such a huge deal for the Lehigh Valley. So, the governor really supported it. There's 100 million, at least 100 million in state incentives going towards this. So, this has been a big project for the economic development folks for a long time. And now you have the school district saying, it's our turn to weigh in and we want to be responsible to our constituents, our families, our students. And it's a tough debate. I think school members feel caught in the middle. I think that's what we're seeing.
Joyce, one of the stories you wrote about was the upcoming primary in the 10th Congressional District, which is in the central Pennsylvania region. And the incumbent, Representative Scott Perry, is running unopposed in the primary, but there are two Democrats vying to challenge him in the November general election. Who are those candidates?
Yeah, we called both of the candidates, Dauphin County Commissioner Justin Douglas, as well as Janelle Stelson. They both are vying against each other. Janelle had what some people think was a pretty remarkable showing in the last election against Perry. She lost, but only by a few thousand votes. So a lot of people in the Democratic Party were simply banking on her to bring it on home this time. But Justin Douglas has stepped in, and Justin Douglas is a popular commissioner. He stepped in and has really brought some fresh air. I would say we've done editorials on this, dealing with the Dauphin County prison system and exposing some of the questionable expenditures, including grant things that have been happening there. So he is popular as well, but the issue is that this is his first term. So some people are saying, why don't you stay focused on Dauphin County and finish that job? But he believes he can do even more if he were to be able to go to Congress. So we've got these two. Janelle Stelson has got the endorsement of the Democratic Party, at least in Dauphin County. And she's got governor's support and other high power support. So the two of them have similar platforms. They're not identical at all, especially when it comes to foreign policy. And Janelle is a little bit softer on deportations, I think, and than he is. He's really strong, and he stood with many of these communities as they have faced their members being deported. So we'll see what happens, but they're going at it right now, hot and heavy.
Kara, we're a few days away from the May 8th deadline for direct home care workers to apply for a retroactive pay increase. Who applies for, or who's eligible for that pay increase, and what do they need to do?
Yeah, direct care workers are home care workers. If you're someone who, maybe you're elderly, senior citizen, or someone with a physical disability, you can choose to receive care in your home. Have someone come help you get ready for the day, bathe, to get dressed. They take care of your meals, maybe do some light housework, maybe do some transportation. So that's the workforce we're talking about. There is a small portion of the clients, around 8,000 Pennsylvanians, who kind of are their own boss. They get the Medicaid or Medicare money goes directly to the client, and then they directly pay someone, direct care worker. They got a $21 million increase in the last state budget, and so that's something that has been officially put into place. Those direct care clients can pay their direct care workers. However, there is a cutoff if you want to apply for that increase. The increase will remain, but if you want to apply and make sure your worker gets paid retroactively back to January 1st, the deadline for that is May 8th. So you could still apply for the increase after May 8th, but then your person would just, start getting their raise from May 8th. There is a chance to, maybe you didn't apply for it until this weekend, your direct care worker could get, the extra pay retroactively back from January, which could be a big boost to many of our direct care workers.
Joyce, you recently attended the Bethel Synagogue's Freedom Seder. Tell us what you saw there.
Oh, well, the Freedom Seder that Bethel does is basically an annual event They've been doing it now, I think, for at least the past decade, and it's focused on uniting the Jewish community and African American community, frankly, and looking at issues of social justice. That's been in civil rights. That's been its focus. This year, they had an interfaith coalition of people that came together, and they always try to deal with what they think the community's top issues were. And we've already talked about deportations. That was top of the list, but also inflation. There's concern that with the pending cutoffs in SNAP benefits, and in October, they're warning healthcare benefits will end for many groups. That is going to have a devastating impact on our communities, and on people being able to simply afford to eat and to live. Churches are gearing up to try to help, but they don't feel it's going to be enough. So there was a lot of discussion about what is our responsibility in a democracy to make sure that all people have a basic standard of living and that no one is basically left behind. Remember, these are people of faith, so they have consciences and they have morals that kind of guide them. And there's very great concern that our nation may be losing those same ideals.
Yeah, there's so much clergy leadership in the emergency response network here, from different denominations. And there's also a lot of interfaith dialogue with the Muslim community here. Saw a lot of interfaith gatherings for Eid recently. I do think that we're seeing people of conscience of all different denominations and all different faiths come together. You know, you see rabbis show up at these events too. So I definitely think there is a very large nationwide debate going on about how different religions are handling some of these issues. And I think we've heard at the federal level concerns about sensitive areas, that taking back the protections for schools and for houses of worship from immigration enforcement. And, you know, that's a thing that Democrats in Congress have said that they want to revisit, but who knows if they will be able to, you know, even get that on the table at the federal level. So at the local level, my sources are saying they're still worried. Everybody has a security plan for their church, their mosque, their synagogue, right? Everyone has a security plan. They won't even talk about the security plan because they're so worried, right? But they have one. But I am hearing that attendance has not dropped as much as people feared, that there are people who, you know, Mass is important to them, services of any kind are important to them, and the churches around here are saying, like, people are still coming out, but that doesn't mean that they're not scared, right? And that doesn't mean that we don't see this interfaith dialogue about how to have thought leadership and moral leadership across these different denominations and these different faiths.
And at the Seder, there also was discussion of the wars as well, including the war between Israel and Gaza. That they, you know, you have to at least take a stand on war in general and on how you treat people of any faith or denomination or ethnicity. So there was just honest dialogue there at this, and I think it's a reflection of what's going on throughout our area.
Kara, 15 seconds, final thought.
Yeah, I would say for quality of life, this is something that state lawmakers, the Sharia administration, are thinking about. They've said that they can't backfill the funds for federal losses to SNAP or to Medicaid. There's administrative burdens that the Department of Human Services is also talking about. So definitely on the minds in the halls of Harrisburg too.
Our guests today have been Elizabeth DeOrnellas, a reporter with The Morning Call, Joyce Davis, opinion editor at PennLive, and Kara Jeffers, Harrisburg correspondent for Lilly Broadcasting. Thanks you all for joining us.
Thanks so much.
Thank you.
Great being with you.
And I'm Phil Beckman. Thank you for watching.
Full episodes of politics and policy content like the program you just listened to are available to stream with the PCN Select app. Discover other shows like The Capitol Preview, On the Issues, candidate interviews, and more. To learn more about PCN's mission and to support PCN with a donation, visit PCNTV.com. This link and others can be found in our show notes. We appreciate your support.